I want to take you to a nice little medical office in a nice little suburb of Atlanta, where some cosmetic surgery patients who went in for simple procedures are now reporting nightmare results. And what may be even more remarkable about this story is that the patients are seeing concrete evidence of what's been going on in the OR of a woman who claims she's a surgeon to the stars, like dancing and rapping and poking and prodding and cutting to the music. And if you think this is some secret video smuggled out of the OR to sink this doctor's reputation and career, you're going to want to think again, because a lawyer for several of the patients says this was actually posted by the doctor on YouTube.
Booty's all fleek, waistline snatched, got a banging body and a smile to match. Yeah, booty's on fleek, waistline snatched.
Well, that is certainly nothing like the mild-mannered surgeon that Dr. Windell Boutte's patients Googled and watched, giving a professional assessment of her practice. Dr. Weintraub is a plastic surgeon. How do you react to seeing this, especially if what Tina just said is true? This is supposed to be helpful to marketing to patients.
I must tell you, it's very upsetting. I did my training here at Cornell in New York City, and the one thing I learned early on was that it's a high honor and a privilege to take care of a patient and to touch a patient, to touch another human.
And to get the trust.
And to feel that trust, and particularly in the operating room, behavior should never be cavalier. This is a very serious place. This is a place where everything has to go according to plan, with organization and backup and proper anesthesia and,
by the way,
nursing
look
and
at the
sterility.
Pictures. It's not just the physician, it's the assistants as well. All seem to be choreographed as part of it.
From where I've come from, at New York Hospital, Cornell Medical Center, I find it hard to watch. I don't even like the phrase selling one's practice. You practice medicine to help people and to act with the highest of conduct.
Okay, there are a few other things that are curious that struck me when I looked at what Dr. Boutte offers. She is, as she says, a board-certified dermatologist. But I want to just go over some of the services that she tells patients she can provide for them, because some of them stand out to me as being very incongruous, say, with a dermatologist. Look at the items in yellow: Brazilian butt lift, breast augmentation, breast lift, buttock augmentation, eyelid surgery, face lift. Again, this is a, you know, she has on her bio, she is a board-certified dermatologist. But the list goes on to suggest hormone replacement therapy, liposuction, a mini tummy tuck, weight loss and wellness, phentermine, which is it's a drug you can take. It's a prescription, and it helps to, you know, curb your appetite. Natural weight loss management, nutrition counseling. All of these seem like they shouldn't be coming from a dermatologist, but Dr. Weintraub, am I wrong? Is that normal for your profession?
It's not normal at all, especially the first set of yellow lettered items. Those are specific surgical procedures. It seems that this individual was trained in medical school and went on to do a dermatology residency. And we all know that dermatology refers to the skin and its surface. Surgical procedures like butt lift or breast augmentation or rhinoplasty and tummy tucks are much, much deeper, involving deep elements of the human body, and have to be under the best of conditions of sterility, staffing, backup, emergency care. We are inspected every 6 months and formally every 3 years in our facility to make sure all of that relates to safety for our patients who undergo these procedures.
Is that, I mean, that's the story. You just heard Susan talking about, you know, Georgia. Is that the story here? Is that the story all over the country? Who the hell is policing this?
Okay, so let me try to set this out for you. There's a difference between medical malpractice, which goes right to reasonable and customary practice in your community.
Okay.
What one does as a plastic surgeon or a dermatologist has to be within those guidelines, or a person can get sued.
Okay.
That is different from the Office of Professional Medical Conduct.
Yeah, aren't those the people who should say professional medical conduct doesn't include rapping, singing, and cutting at the same time?
Absolutely. Because that board or that body holds our licensure. Conduct means conduct around a patient,
but
conduct in the
Is this slipping
operatory.
through the cracks? Look at this conduct in the operatory. Look at this. Is this slipping through the cracks, or is there some reasonable explanation that the Office of Professional Medical Conduct in Georgia could ascribe to this video and say, you know, it doesn't rise to the level of taking her license?
I just can't imagine it from the clips you've shown me.
Does it need to be on national TV before they wake up, or what is the protocol here?
There's a problem there. I know in New York State, issues of this nature, again in the videos you've shown me, would be a very, very egregious thing. And what you have here are both issues. You have med mal issues and Office of Professional Medical Conduct issues.
Yeah.
One results in a lawsuit, the other one results in retraction of your licensure. Now, Susan said something very important. And here's the loophole. You can go to medical school and do an internship and put out a shingle that you're a neurosurgeon in the United States of America. The problem is that you'll never get hospital privileges as a neurosurgeon, so you can't open someone's head,
You got to do
for
it in
example.
your office.
However, if someone opens up an office and says, I'm a neurosurgeon, and they're crazy enough to go into a private office, even with an
and make a nice-looking shingle. Dr. Barry Weintraub is a board-certified plastic surgeon in the New York area and has been watching along and seeing alongside a lot of this coverage and is going to weigh in on the legal side of it from the medical standpoint and from the ethical standpoint. So what I'm going to do before we go to break is I'm going to ask our control room, I don't know if you can do it on a split screen, but I would like to be able to play the soundbite number 3, which is the life of misery. But at the same time, if it's possible to put Dr. Weintraub on a split screen to just get his reaction as he's seeing that along with the rest of us. And Dr. Barry Weintraub, as a plastic surgeon, I looked at your face while you watched that video, and I wasn't sure quite what to make of it, other than you were trying to be poker face, but I know that you're probably dying inside.
It's not something any board-certified plastic surgeon wants to see. Remember, we talk about cavalier behavior in the operating room, never to happen. That's a human being on the table, and it goes to issues of professional conduct, respect, ethics.
For the patient and for the practice of medicine, right?
Yes.
So look, I know a lot of doctors dance, or they don't dance, but they listen to music in the OR. I've seen plenty of doctors who have music playing in the OR. It's relaxing, it can help them. That's not unusual.
That's not unusual.
But the dancing and the choreography and the graphics, woo, 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 over a video that is posted to your YouTube account to generate business?
Let's say I've never seen that, but let me tell you something else that struck me in the number of videos that were shown to me. The issue of sterility is paramount in any surgical procedure.
Well, why is that not sterile? I mean,
because there are videos I looked at where there's no mask on, gloves should never go.
No mask there. Yeah.
Gloves should never go below the waist.
Really?
Behind your back, or even to touch your head, let alone touch a mask. So you have sterility issues that once violated, you're enormously opening up the problem of an infection.
There's no mask there either, as you just mentioned. I didn't realize that gloves couldn't go below the waist.
No.
These ones are behind their
your
backs.
back.
Now it's on her face.
On face.
Oh,
That's
boy.
if they are scrubbed to do surgery. It's completely out of the question. The gloves are purple. Some purple gloves are for sterile procedures, but some are for non-sterile ones. But I'm assuming this is a surgical procedure you're looking at, and the gloves are everywhere they shouldn't be. In addition, on another one, the anesthesiologist, or whoever that was at the head of the table, reached over onto the surgical field with a plain hand, which is never to be done either.
You saw that on a video?
Yes, I did.
And speaking to that, you know, we just heard Mitzi and Christine and their stories, and Mitzi said that she wasn't even told she would need someone to drive her out of the procedure. Is there any kind of procedure that you would go in for where you wouldn't need someone to drive you home if you were sedated? Anything?
No. A person who's sedated must have an escort, especially in the state of New York. I don't know how other states are, but that patient was getting what we call smart lipo. Smart lipo.
Yeah, tell me what the difference between surgical lipo and smart lipo are.
Okay. This is invasive stuff. This is not superficial. Smart lipo is laser lipo, which is not lipo. It's a probe that melts fat.
No cutting?
No cutting. However, after the fat is melted, traditional liposuction must follow in order to remove the oil. So instead of doing traditional liposuction where you're removing fat in one fell swoop, the fat is melted first, then extracted. These probes can be long and pointed. Organs can be punctured. All sorts of things can be happening.
So a smart lipo procedure, even though there's the laser melting going on, is followed immediately in the same operation by the invasive.
Traditional lipo, yes.
So you're getting the traditional whether you know it or not.
That's right.
Well, that's a whole different kettle of fish. One of the things that you said, it's obviously distressing, it's moral or immoral to be dancing and jiggling someone's belly that's unconscious on the operating table. But then there's the notion of the danger of cutting while dancing. And I want to play one particular video because I think it's what I worried about the most when I saw this. And that was that there's a song called Cut It by O.J. Genesis. It's a popular rap song. And this is being parodied in the OR, Cut It. And there's a whole choreographed dance going on with the assistants. And they're singing Cut It while actually cutting. We've had to digitize some of it. We can't show that kind of thing, but you can see most of it. Have a look. So, Dr. Weintraub, you have a policing authority in your line of work. I always think, where's the AMA, for golly's sake? Why isn't the AMA yanking that license? It's not the AMA that would yank a license, but it is the Office of Professional Medical Conduct.
Correct.
Have they seen these videos? And if they have, could you imagine that these processes aren't in the works to remove her license?
I think that, as the attorney said, I can't imagine it not being removed. The conduct holds your license, and there is a specific conduct that one must employ when treating and touching patients. And what I saw in the video was dancing and singing, but at the same time holding a scalpel and severing the skin. There was some blood shown too, and if that was an awake patient or an alive patient, the last thing you want to do is be moving. I mean, that's the time to concentrate and literally have silence and concentrate on what you're doing.
So, I mean, all of this just sounds like a no-brainer to me. What I still can't get my head around is why she's still practicing. Because she has not lost her license. She's still, you know, accepting patients. And where is the Office of Professional Medical Conduct in this? Or have they perhaps just not seen the videos?
I can't imagine they haven't, but back to your question. The AMA is not a governing body, but a society very much like the United Nations, wherein they can recommend, but they don't have teeth.
Yeah, they can't yank.
They can't yank. The Office of Professional Medical Conduct can pull a license, suspend a license, do anything it wants based on the facts and data that's put before them. Medical malpractice is what the attorney referred to as a civil issue.
Well, we'll see where this all goes. So much of it is so astounding to me.